Hi guys, Brian. We're gonna go ahead and do our trauma assessment today. So for trauma, we have our indications, which are going to be trauma unresponsive, our contraindications, which are going to be CPR and relieve destructed airway. Um, from that, we have 7 load and go criteria. So our 7 load and goes are going to be altered level of consciousness, compromised ABCs, uncontrolled hemorrhaging, abnormal chest, tender abdomen, unstable pelvis, and bilateral femur fracture. So those are the 7 things to keep in mind. Um, from that, we're going to go ahead and do our on call when we receive our call, which is going to be BSI penman, so body substance isolation. Penman is going to be personal safety, partner safety, patient safety, public safety. E is for environmental hazards, and it's for a number of patients. M is going to be mechanism of injury or nature of illness. A is for additional resources, and N is going to be for need for extraction. Once you arrive on scene, you're gonna do your general impression. So radio, whether it's sex, height, weight, ethnicity, and you're going to, when you arrive on scene, you're gonna approach from the feet. You're going to have somebody hold manual C-spine, and also observe for any major bleeding and delegate bleeding control. Once you do that, you are going to check the patient for AVPU, so make sure they are alert, verbal, respond to painful stimuli, or they are unresponsive. After that, you are going to check their ABCs. So you're going to go ahead and do airway, make sure it is open, clear, maintainable, need for suction. Um, patient needs any airway adjuncts or suctioning. For breathing, we're going to do rate, depth, ease, lung sounds, as well as SpO2 and the patient's appropriate need for oxygen therapy. C, we have circulation, which is going to be the rate, rhythm, quality, skin, skin signs, so color, moisture, temperature, cap refill, as well as cut and expose the clothing and look for any uncontrollable, uncontrollable hemorrhaging and life-threatening hemorrhaging. So once we do all of the ABCs, that's going to be your load and go criteria right there, your first load and go, whether you need to take the patient and you're going to take them or they're going to be a stay and play. Either way, you're going to go on to your delegate vitals. So you're going to have somebody grab vitals for you, which is going to be um, blood pressure, pupils or pearl, um, pulse, respirations, as well as skin signs and blood glucose. So you're gonna have somebody delegate that. You're gonna delegate somebody to or you could delegate yourself to take sample. So signs and symptoms, allergies. The patient, if they're responsive, you're gonna make sure you get their allergies, any medications they are taking, um, past history of any illnesses or diseases, last oral intake, as well as events preceding, leading up to the event. And then you're gonna also delegate somebody to grab a backboard and prepare the backboard, so that way you could put the patient on later. So after that, you are going to go ahead and check the patient, starting at the head with decap BLS, so deformities, contusions, abrasions, punctures, burns, um, decap BLS, burns, deformity, contusions, abrasions, punctures, burns, lacerations, or swelling. And you're going to palpate the back of the scalp for blood on gloves. Once you do that, you're going to move on to the neck anterior decap BLS. You're going to check tracheal deviation, jugular vein distension, stoma, a medical ID, as well as subcutaneous emphysema. And then you're going to palpate the back for point tenderness and step off, as well as glove on, blood on glove. And then you're going to move on to your chest, observe for decap BLS, as well as paradoxal movement, flail segment, sucking chest wound, and impaled objects. And you are going to palpate anterior anterior to posterior, as well as lateral to medial, checking the chest, palpating for tick. And once you do that, you're going to go ahead and auscultate as well for lung sounds, bilaterally and mid-axillary lung sounds. Then you're going to move on to the abdomen, where you're going to do decap BLS as well, and observe for evisceration. Once you do that, you're going to palpate the abdomen, checking for tenderness, rigidity, distension, guarding, hot belly, and pulsating masses, AAA. Once you do that, you could go ahead and move on to the pelvis, where you are going to observe for decap BLS, as well as priapism, vaginal discharge, and incontinence. And you are going to palpate for tick, anterior to posterior, as well as lateral to medial. And then you're going to move on to the upper thighs. Once you get to the upper thighs, you're going to observe for decap BLS, as well as check for tick with offset pressure on both legs. Once you get to the knees and you are done checking the upper thighs, upper extremities, that's going to be your second load and go criteria, whether the patient is a load and go or you still stay in play. So that's your second chance. After that, you're going to go into the lower extremities, the lower leg. You're going to check for decap BLS as well as offset pressure. And then you're going to check PMSCs on the foot. So you're going to check the dorsal pulse. Once you check the dorsal pulse, you're going to check for PMSCs, which is pulse, motor, sensory, and cap refill. So for motor, you would go ahead and push on my hands like a gas pedal. And sensory, you would grab their big toe or any toe and would say, what toe am I touching, what toe am I touching, cap refills on both. Then you would move up to the upper extremities, observe for decap BLS on both arms, and go ahead and observe for tick palpate for tick with offset pressure, palpate for tick with offset pressure, and then PMSCs as well. So check the radial pulse, and then you would have them squeeze my fingers. Okay, and with squeeze your fingers. What finger am I touching? What finger am I touching? Cap refill, cap refill. As soon as you are done with that, you're going to do a log roll on the patient to check the back on the headman's count. 1, 2, 3. You would flip the patient over. You're going to observe for decap BLS on the back, as well as flail segment, sucking chest wound, paradoxal movement. You're going to palpate the spine for spinal alignment, step off, as well as point tenderness. You're also going to check the back pocket for a wallet, so if the patient has an ID in there. On the count of 3, you would put the patient, slide the backboard under the patient. You would lay the patient down on the backboard, and you would do a Z-track movement on the headman's count. So 1, 2, 3 down, 1, 2, 3 up, and then the patient would be perfectly aligned on the backboard, and you would strap the patient in on the backboard. Once the patient is strapped in the backboard, you have 10 minutes to transport the patient within 10 minutes. So once you are done with that, you are going to, en route, you're going to do your ongoing assessment, which will be for AV, AFPU, ABCs, vitals, and your interventions, where you would give any interventions, if whatever it may be. And then you're going to do a rapid assessment of your head to toe assessment. So checking, you would check the nose, the nares, the mouth, facial bones, as well as the ears for cerebral spinal fluid, CSF, the halo test. You would check the ears for that, and you would also treat any secondary injuries from that point. And that's it.